So with the chemical peel, we're going to use 3 different products. The first product is going to be peel prep, which is right here. The peel prep will prepare the skin for the chemical peel by removing all the oils from the face. This step is crucial as it will help the chemical peel to penetrate the skin more effectively. After that, we will proceed with the stimulator peel. So what exactly does the stimulator peel do? It's our chemical peel. So it's the one that's going to perform the descalming effect, the cheetolytic effect on the face. And then following that, we'll also use the neutralizer. The neutralizer works to restore the pH to a neutral pH. An acid has an acidic pH. This will have an alkaline pH. This causes a chemical reaction to occur in the face. The client may therefore feel some discomfort with the neutralizer. So before starting the chemical peel, we first protect certain areas of the face with petroleum jelly. When you pick up the petroleum jelly, it's important to take a sufficient quantity with this small cotton pad. This ensures proper coverage and protection. We do not dip it back into the container, otherwise you'll contaminate the product. I've picked enough product, so I'm going to put the excess on the back of my hand so I can use this product without having to worry about contaminating it. So the areas we're going to protect are the inner corner of the eyes and all the areas that are a little more sensitive, like the outer corner. You don't have to put it all over the eyes. Just the outer and inner corners. Now I'm going to use a little more product. I'm going to protect the mucous membranes of the lips, then throw away the excess. Let's prepare the products. I'll start with the peel prep. We'll use an entire pipette of product. So you don't necessarily have to calculate the exact number. All you need to do is press down on the pipette, extract the product, and place it on the cotton pad within the container. Since peel prep is the preparation, we don't want any contamination with the second product. I'm going to throw away my pipette in the garbage can so as not to make a mistake with the second one here. So I've finished with the peel prep. Now let's use the second pipette and the simulator peel. So same thing, we take a quantity, so a full pipette, and we're going to put it on the cotton pad. So you might need to add a bit more product. So I'll keep my pipette close by in case I notice that my cotton pad is too dry. So now we're moving on to the neutralizer. For the neutralizer, you need to do about 10 pumps because we want the cotton to be thoroughly saturated. So we start with peel prep. I soak my cotton well. Then I'll fold my cotton into quarters for better dexterity. Right now, my cotton is completely saturated. I won't start with the forehead, otherwise there's a risk of the product falling into the eyes. Instead, I begin with the lower part of the face. And then I go all over. So it may sting a bit on the face. That's perfectly normal, just like that. So it's a quick pass. Then I'll repeat the same procedure on the other side. There is no problem with passing on active acne with a chemical peel. Then we'll continue with the stimulator peel, which is our peel. Same thing, I'm going to fold my cotton into quarters for greater precision. My cotton is still saturated, so I'll start with the lower part of the face. At the moment, it may sting a little more than before. That's normal. It's the effect of the chemical peel. And I'll repeat the same thing on the other side. I'll do it again on the other side. So we can ask the customer to tell us from 0 to 10 how much discomfort she feels. If she tells us that it's more than 3 to 4 on 10, we'll have to neutralize and rinse. If it's tolerable and less than 3 to 4 on 10, we can continue. So we'll leave it on for about 3 to 5 minutes, depending on the chemical peel you're using. I suggest you always rely on the manufacturer's protocol. They are going to be the most knowledgeable about their products because every product is different. So with chemical peels, there are three types. There is the superficial chemical peel, which is what we're doing now. There is the medium chemical peel, and then there is the deep chemical peel. The superficial chemical peel tends to have fewer side effects afterwards. There might be a small but very slight desquamation on the face. However, there are also some people who may not experience any at all. An average chemical peel, on the other hand, will produce slightly more desquamation. So it really has a peeling effect, somewhat like a snake shedding its skin. Yeah. On the other hand, a deep chemical peel, which can only be performed by medical professionals, will result in much more desquamation, many more side effects, and will require the client to be under sedation and also under cardiac monitoring. So with chemical peels, once you've done your bit everywhere, you can do a second little bit on the specific imperfections. Let's say the customer has scars. I can come in and do a second pass on that area. On enlarged pores, a second small pass could be made at this point. Pigment spots, same thing. A deep wrinkle. So let's say the client had a forehead wrinkle here. Then I could come and stretch the wrinkle and come directly inside the wrinkle. Right now, Ryan doesn't have one, but it's something that's possible. So now we'll take the cotton with the neutralizer and just soak it in thoroughly. We'll make sure the cotton is completely saturated, ensuring every part is covered. I'll also make sure to fold the cotton carefully to ensure better handling and to make it easier to use. So it might tingle a bit more or feel extremely hot. However, it will only last for a few minutes. Don't worry, the sensation will pass quickly. You rub it gently all over the face, and then if you can see, it creates quite a bit of a foaming effect on the skin. So it's somewhat like taking vinegar and baking soda. It creates a noticeable chemical reaction. Chemical peeling works in exactly the same way. I'd strongly recommend you neutralize twice or even more. Just be sure it neutralizes properly. We really want to make sure it's neutralized everywhere. Make sure you neutralize further than you think. So if the peel has fallen on the neck, we can go a little further, even if we haven't thought about it there. The hairline, the eyebrows, the wings of the nose, under the nose. We really want to ensure complete neutralization everywhere. Make sure you neutralize further than you believe is necessary. For instance, if the peel has reached the neck, we should extend further, even if we hadn't considered it. With a chemical peel, once the neutralizer is on the skin, it's possible to come and do an extraction. Yeah. So that's when we do it. Obviously, not all clients need it, but that's when we could do it. So I could come and remove the blackheads. When you remove a blackhead, it's important not to just go to the surface and pop it. You have to make a sort of J shape, because if you remember, in the corneal layer, in the layers of skin, the follicle goes a little deeper. The comedo will often be found at the level of the follicle. So we're going to pick it up from the inside and push it outwards. So we'll make a J. I'm going to pull the skin. I'm going to come to the side, and we're going to apply a little bit of pressure. Remember to make a J shape. So on the wings of the nose, you could go like this. Personally, I find that we're less well positioned, and it's much more difficult to extract. I pull the cheek a little more outwards. And the nose as well. I come to rest a little on the nostril and on the inside of the cheek here. I'm putting pressure between the two. The natural pressure in the inner corner of the nostril will make the extraction process easier. So when we perform an extraction, it can be very tempting to come over and deal with the little active acne that's present here. Obviously, you've got a small white head. It's quite active and it's inflamed. You really don't want to pierce the skin. Otherwise, we run the risk of spreading the bacteria all over the place. So we really want to let it heal naturally. That's why we're going to use spot treatments, such as hydrocolloids, clay masks, so internal sulfur masks. We are going to remove out each and every one of the small imperfections that are on the side. So with the neutralizer we use at school, it's quite normal to notice a whitening effect on the face. Essentially, it's the baking soda inside the neutralizer that performs this function. Once you've completed the process, rinse the face thoroughly with a towel. Additionally, you could clean the face again and do another cleanse to ensure there's absolutely no residue left. But this step is not strictly necessary. I'll frequently advise to do it if, for example, you're performing a significant extraction on someone who has a lot of comedones. This is to ensure you eliminate all the small comedones you've extracted to make sure there are none left on the skin. However, in this particular case, it won't be necessary. I make sure I've rinsed all the areas thoroughly. So redness on the face is perfectly normal. We did 2 treatments today, so we really stimulated the skin. It'll disappear in a few hours. However, it may take until the next morning for the slightly more sensitive spots to disappear completely. Since we did a dermaplaning, similar to a razor burn, when a product will be applied on top, it may sting more. That's normal too. So it's important to inform the customer. And that's going to be the same throughout any treatment. And then always inform the client of any feeling she may have. So in this case, for the chemical peel, it will be the tingling and feeling of warmth. And for the dermaplaning, it will be the warming effect following the treatment. These are very important things to mention. They should not be overlooked. So we are going to use a moisturizing cream to complete the treatment. It can also be a serum. If you use a serum, we will finish with a moisturizing cream. In Zoskin, we don't exactly have a moisturizing cream. It's more a cream serum. So we will use that here. It's also at this point that I could come and perform a gentle massage on the face. It's not something you absolutely have to do, but it's something you could offer to the customer. Note that applying the cream might sting a bit. So given that we've done a treatment that's a little more sensitizing, a little more abrasive, we'll always finish with an SPF. So we'll choose the SPF according to what our customers prefer. Of course, lighter SPFs won't work as well on darker phototypes since they leave a whitish effect. So we choose the SPF accordingly. The treatment is now complete. All that's left is for you to advise the customer on products and treatments. And we're done for today.